So Jane, welcome to the practice. I'm so glad to have you.
Thank you.
How has the first day been so far?
It's not bad.
Great. So you had some shadowing time with me this morning, and you got to see a little bit about how the office runs and how we see patients here and stuff. Now, just so I can orient myself with you, what rotations have you done so far in your third year?
So far I've done medicine and I've done peds. I did quite a bit of outpatient actually. So
Oh, good. That's great. That's good. So you're ready to start family medicine then?
definitely.
Good. That's great. Well, I know the first day, the first couple of days in a new clerkship can be rough, and also just getting to know a new office, and we want you to feel comfortable here. So please let me know if there's anything you have questions about or that doesn't seem clear, with the patients or with how the office flow goes, okay? And let's see. I think what we should do this afternoon is have you come see some patients with me initially. Maybe we can find somebody in the schedule that would be good for you to see and take the history from by yourself, if that sounds okay. Does that sound
great.
okay? Okay. Let me just look at my schedule. Oh, this is good. So I have a guy coming in at 4 this afternoon. His name's Mr. Patrick. He would be a good person for you to see, and there's plenty of time between now and then, so you could go through his medical record and review his last couple of visits, and that might make you feel a little bit more ready to see him. So he's interesting. He's a 45-year-old guy with diabetes.
Oh, that's great. I actually saw quite a few patients with diabetes. So
Oh,
that
good.
would be great to see it in an outpatient
when you
setting.
were in medicine?
Mhm.
Oh, good. Okay, that's great. Yeah, so, I think it would be good to look through his chart, look at his last couple of visits, and that might give you a better sense of kind of what treatment decisions need to be made about him, where we're at with the management of his diabetes, and whether there's anything about the plan that you want to think about ahead of time, Yeah. So just a little background on him. He's 45. His diabetes hasn't been very well controlled, actually, lately. And I think the last visit, or the time before that, he had an A1C that was around 9.
Okay.
And so I started him on glipizide. That's a sulfonylurea. And sometimes patients on glipizide can have hypoglycemia.
Right.
So I usually ask them about symptoms of hypoglycemia, dizziness, lightheadedness, feeling weak, that kind of thing. If he's had low blood sugars when he checks his sugar at home. So I would ask him about that stuff, and obviously if he's having any symptoms like that, then we need to think about stopping it, unfortunately. So it would be good to review those things with him, and then just in general, how often is he checking his sugar, how have his sugars at home been, has he had symptoms of hyperglycemia as well, all of those things. And I think that would be a good start for you to start thinking about those things, and then we can talk about whether we need to change his meds or not. Does that sound okay?
That sounds fine.
All right, great, good. So why don't we go see the next lady, and you can see her with me, and then I'll give you a little bit of time. I'll just see some patients by myself, and you can have a little bit of time to sit with his chart and get to know him a little.
Great.